Welcome to All Things Keto. I am Dr. Pete and I am your host. I am a PhD biochemist. I am a certified health coach and I have specialized certifications from Nutrition Network in the clinical application of diets which are low in carbohydrate, high in fat, and moderate in protein, otherwise known as the ketogenic diet. And the reason that I am with you this morning is to talk about the COVID-19 pandemic and its relationship to the biggest risk factors, which are chronic disease. So to review COVID-19 at the outset, and this is based on data from the CDC that was published on their website on May 15th, 2020. So again, the symptoms from exposure to onset is usually about 14 days, although the median for cases can be as short as 4 or 5 days. Usually the symptoms, and here's the thing about the symptoms, is that this virus at least appears to be fairly global in the systems that it affects once it's infected an individual. So this is not going to be the same in every single individual. But in general, the cassette of symptoms are fever, a dry cough, fatigue, overall body aches and pains, headaches possibly, and then short of breath. And then there are others as well. Some people experience diarrhea and so on. There is increased risk for infection, and I'm going to give you the list directly from the CDC. So aged individuals, people that are 60 years old or older, are at higher risk, and I'm going to address the reason for that in a second, or at least the main reason for it. People with cardiovascular disease, diabetes, kidney disease, hypertension, which is high blood pressure, and obesity. So all of these factors have in common the fact that systemic inflammation plays a major role. And how does this happen? All right, for the aged individuals, systemic inflammation is coming from, especially in individuals who have been eating the standard American diet for the most of their lives. All right, and the problem with the standard American diet is literally the high percentage of carbohydrates that are in the diet, anywhere from 45 to, my experience has been looking at statistics even as high as 75% carbohydrates on a daily basis. Why are the carbohydrates at such a high percentage bad? Simply because this type of diet stimulates high levels of insulin in a chronic way, and insulin is a master hormone that causes dysregulation of a lot of systems, one of which is to enhance overall chronic inflammation of your body and the systems that are in your body. And this particular virus capitalizes on a system which is already inflamed. How do we end up with the inflammation? High levels of carbohydrates in the diet, eaten chronically over many decades. And that's where the age thing comes in. The reason why this is really hitting people that are older, it's not just because they're older. It's because it takes decades of eating the standard American diet before you damage our organ systems on a global level in terms of the systemic inflammation. That necessarily means those of us that are in our 60s and older have a greater probability of having this inflammation before being infected by a virus that capitalizes on inflammation. Now, what are the hospitals able to do about this? And this is the thing that you got to know about the healthcare network that we have right now. You know, they're really good at certain things and they're not so good at others. If you go into an emergency room and you've got your arm cut open, they're really good at that, right? They're going to be able to take you. They're going to be able to stifle the bleeding. They're going to be able to sew you up. That is something they're good with, right? They're good at single point, acute types of things which are identifiable and then easily fixed. So you have a headache, you can take an aspirin and the headache goes away. They're not so good at things which are systemic and where there are not, or where there are not known single point things that are being done by the ailment. All right, one of which is this virus, which seems to be global in what it can do and flexible in what it does, and capitalizing on systemic inflammation. So, using the words of the CDC, this is what the hospitals are doing. They're using supportive management. So, what does it mean, supportive management? It means that basically they don't have a, a, a serious single point treatment that they can do for this virus. So, they're throwing everything they got at the wall. And that's why the individuals who have serious symptoms by this um, uh, virus and end up in the ICU are having problems surviving it, because basically the hospital, and they're doing the best they can, I'm not criticizing the hospital, is throwing everything they got at the wall and seeing what sticks. And sometimes for some patients, some things stick, like the ventilator. While for some other patients, putting them on a ventilator is not going to help, and eventually, they're going to die. And this is because we don't have a specific treatment for this. And some of you may go, but well, wait, Dr. Pete, what about remdesivir? All right, and the FDA has opened this up for emergency use, and it seems to be working in a lot of cases, but it's not the hallelujah drug, right? You take this stuff and it doesn't necessarily pull you out of deep trouble. It seems to lessen the most severe of the symptoms. We don't have anything in the United States, or even the world for that matter, right now, a treatment for this virus, a specific treatment that's been shown to work for this virus. We don't have it yet. So what can we do if we're individuals that are suffering from chronic disease like diabetes, obesity, cardiovascular disease, and you haven't already shifted to a diet that is low in carbohydrates? This is an opportunity for you to do that, all right? To shift to a diet that is low in carbohydrates, otherwise known as the keto diet or the ketogenic diet, which is low in carbohydrate, high in natural fats, and moderate in quality proteins. So, what can you do right now to shift yourself away or out of this risk group, or to shift your way out of the potential for becoming part of the risk group? Stop eating sugars. That means colas, for example, that are high in sugar. In the field, we use the acronym NO GPS. That would be no grains, no potatoes, no sugars. Stop eating out of boxes and out of packages. Those things are loaded with all kinds of carbohydrates and sugars, and other ingredients which have chemical names but no bearing to actual food. Eat brightly colored vegetables, all right, and high quality meat. And when I say high quality meat, I mean unprocessed meat, like not stuff that you're buying out of the deli that has been taken from an animal, ground up, and then mixed with a whole bunch of things, including sugars. All right. And for more information, if you're interested in being serious about uh, entering a phase of your life that is more healthy, contact Ketonic Revolution, and you can find us at ketonicrevolution@gmail.com. And with that, I'm going to go ahead and sign off. Have a really, really great day.